Terri, thank you for joining us at Cedarwood School. I'm so delighted that you've brought your colleague with you, Dr. Terri Nunes. So even more so being a pediatric doctor and a neurologist in pediatrics, I think we're very fortunate to have both of you come and talk to us today and just explain to us really more about COVID-19 and especially the effects that it has on children.
It's wonderful to be here at Cedarwood, and it's very special to have been invited to talk to the parents and to the children. This is a wonderful school with amazing facilities, and we're here to talk to you about coronavirus because this new virus has come into our world and turned it upside down. The thing about COVID-19 is it doesn't seem to affect the children as much as the adults. So worldwide, the children have been less than 3% of the documented infections. So they seem to get it less frequently, spread it less frequently, and when they do get sick with it, it's not as severe as in adults. So children are relatively protected from this coronavirus. So how does COVID-19 spread? Well, this coronavirus is found in the nasal tract and in the mucosa. So when the virus is replicating, actively replicating, people are talking, so they're spitting out saliva and droplets, or they sneeze and they cough, and the virus then is transmitted into the air and lands on surfaces. So it's spread by people talking, and it's spreading onto surfaces, people touching the surfaces and then touching their faces, which is why it's so important to wear a mask, because that prevents people from spreading it, and to be aware when touching surfaces that you clean your hands all the time and prevent it from going onto your face.
So Terri, when you say wash your hands at school, we do encourage the children to wash their hands with soap and water. We also have hand sanitizer in the office and all the classrooms. But what would your recommendation be in terms of keeping your hands clean and proper hand washing?
So I think proper hand washing is actually better than sanitizer. So you can use a combination of both, and there's certain times where there is no water available, and then the hand sanitizer would work for those instances. But it's very important if the kids continuously wash their hands and wash them well. So it's important to teach them to actually rub their hands, wash for 20 seconds, and dry their hands well. And once that happens, the virus then is removed from their hands, less likely then to be spread. And that's the importance of hand washing. But sanitizers are useful in places where you don't have water, and for argument's sake, inside and outside, going inside and outside a classroom.
So we are fortunate at Cedarwood that we have been able to have our children come back to school. Dr. Terri, why is it important that children do come back to school?
So especially for the children here at Cedarwood, they need the psychosocial interaction, and they learn so much more from human interaction than they do on a screen. And so even though they're not directly together, and you see these blocks here, being socially distanced, but they can still see each other, they can still communicate with each other. And a lot of learning is through communication, and it's those subtle things like talking to each other and laughing together that makes a difference. And so you learn more easily when you're around other people than when you're home alone. Again, therapy here is so important, that one-on-one therapy. So the children don't only come here for the schooling, they come here for the occupational therapy and the physiotherapy, and that needs to happen, and it can and it does happen here in a safe area, considering that we are in the middle of a coronavirus outbreak. You are still very cautious, things are being cleaned, surfaces are being wiped, and everyone's very aware of the infection risk. So it's a very safe environment to come back to.
So we are very proud of what we have achieved at Cedarwood, getting the school ready, but there are some cases where children might be at a slightly higher risk than other children. What would you say about children that may have other underlying issues or comorbidities about them returning back to school?
So I think each parent needs to work out the risk for themselves. I think it's very important, if you have a child with comorbidities, to see your pediatrician and to let that child be examined, because as pediatricians as a group, private and academic pediatricians across South Africa, we have put out a statement, a mission statement, that we want all children to return back to school. We do realize, however, that there is a subset of children, those that may have immune deficiencies, that cannot return back to school, those that have illnesses which are not controlled. But certainly a well-controlled asthmatic, a mild CP could probably safely come back to school without any concerns. So I think it's important for the children and for the parents who are concerned to go and see your pediatrician, and they will best guide you, because all of us pediatricians want the children to come back to school and to be able to learn in the environment that they're happy in.
You say we could go about making the most of the situation that we currently find ourselves in.
So it's wonderful that the kids have got all the space to exercise and run around in. So they're coming back to a safe environment. They're coming back to an environment where the classes are small, there is social distancing, they're getting the benefits of seeing each other and being together, the benefits of having their therapy, and also being able to play outside with all of this around them. So I think there's no doubt about it that it is safe to return to Cedarwood, and it is better for the children to come back to school, given the fact that they don't have necessary comorbidities. But a lot of these children just need a little bit of assistance at school and actually are quite healthy. And for the majority of healthy children, they won't even know that they've had coronavirus. So it's the virus is amongst us, and in Johannesburg the numbers are definitely escalating. But people that we have to protect are the vulnerable in our society, and they tend to be the elderly and those adults with comorbidities.
One thing that I would like to address with you is if somebody does develop COVID-19, and the stigmatization around it, how as a community is it best for us to handle something like that?
So what I think is very important to understand is that we all are going to be exposed, not through any fault of our own, okay, and not from those around us, because this virus is everywhere. It could be in your shopping centers. When you go, as you go up an escalator, you might touch the edge of the handles. So you are going to be exposed, and it's all around us at the moment. So if you protect yourself, that's very important. But even with the best protection, you may get this coronavirus. So if you test positive, the most important thing is to tell people around you to stay at home. And once you've tested positive, the guidelines are very clear. You isolate at home with your family, ideally self-isolation, but you isolate at home for 14 days. And then the contact tracing is important, to let people around you know. And it's important to understand that we're all going to be exposed. How you got it is not what's important, it's how you manage it once you know that you have it. So from my side, this can't be a stigmatizing disease, because it's a virus, it's a novel virus. We all have to acquire it to get herd immunity. So the question people have asked me is, what is herd immunity? Well, herd immunity is when the majority of us have actually had this infection and we have now got antibodies to it. And because 60% of our population have had it, there's less people spreading it, and there's less people acquiring it. So basically then it doesn't become worse than the flu. And that's important. So herd immunity is about letting people become infected, getting over the disease, acquiring the antibodies, and then diminishing the spread. Because right now it's spreading because people have never been exposed to this virus before.
How long should we expect for this all to last?
So that is the $1 million question. We are just starting to see the increase in the number of people acquiring the virus. So Johannesburg rates are starting to increase now. So until we have herd immunity, which we've just discussed, or until a vaccine comes into being, screening is going to continue like this. And certainly until the end of this year and possibly into next year. What's important to understand is that the vaccine is nowhere near. They're only on the early trials in the vaccine. That vaccine has to be trialed, shown to be effective. Once it's shown to be effective, it has to be produced. And it has to be produced in volumes that it can be spread to the world to give them immunity. So in reality, a vaccine is probably 18 months away. So we need to learn to live with coronavirus in 2020 in South Africa. And we need to let the kids come back to school practicing social distancing, but come into a safe environment where they can learn again. And yes, we will have times where we'll have to go down back into homeschooling. So we don't know what to anticipate going forward. But we have, thank God, the benefit of actually schooling at home and being able to come into the school environment.
And what about the staff that might have fears around COVID-19 or might be vulnerable in a vulnerable state?
So this disease is definitely affecting the elderly and those with comorbidities more. So staff need to be aware that if they fall into those categories, they need to be very careful. So if they feel that they cannot come back into the environment, that is something that they need to address with the principal. But I do believe that if you come into this environment prepared, you practice social distancing, you use the right kind of personal protective equipment, even in the classroom, and you social distance from the children, you are at no greater risk here than at the shopping centre. So it's important for vulnerable staff to know that they can come back into this environment safely, provided they practice their social distancing and all the things we've discussed before. Staff also need to be aware that they're actually more vulnerable in the staff room than necessarily in the classroom. So the studies so far have shown that children of like ages are likely to spread it to each other as opposed to spread it to the adults. So the adults are more likely to spread it to each other. So that's important for the staff to know when they are in periods of high risk, or where they are in situations of high risk.
Dr. Terri, it has been such a privilege and honor being able to chat to you. I've really, really enjoyed hearing all you've had to say on this topic. What are your final thoughts on children and staff members returning back to school?
So I think it's fantastic, and I do think the children need to come back to school. So Dr. Hansen and I have toured the facility, and you are prepared. You have got your policies and guidelines in place. You have got all the necessary things to safe school the kids back at school. So ultimately it's the parents' decision, but do bear in mind that coronavirus is not going away, and we are going to keep up with this new norm for at least the next 18 months. But from my side, you have put things in place, and the school is looking fantastic and ready to have the children back here safely in the time of this pandemic.